Good afternoon. My name is Paul Cleary. I'm the Dean of the Yale School of Public Health, and I'm absolutely delighted to welcome all of you to this third conferment of the Centennial Award of the CEA Winslow Medal by the Yale School of Public Health on Dr. Judith Rodin. On behalf of the school, I'd like to extend our immense gratitude to the faculty, staff, students, and alumni representatives that comprise both the Winslow Medal Selection Committee and the Centennial Planning Committee, both chaired by our Deputy Dean, Dr. Brian Lederer, for making this historic occasion possible. The Winslow Medal is given in honor of the founder of our school, and many say founder of modern public health in the United States. It's awarded to world-renowned innovators with distinguished careers and outstanding achievements in public health leadership, scholarship, and contributions to society. Past recipients include Sir Richard Dahl, Bill Foege, Sir Ian Chalmers, and in this centennial year, Sir Michael Marmot and Dr. Anthony Fauci. Nominations for the Centennial Medal were sought from the entire Yale School of Public Health community, from the deans of schools of public health throughout the country, as well as from key leaders at the National Institutes of Health, the Centers for Disease Control, and the World Health Organization. Before introducing Dr. Rodin, permit me to say a few words about CEA Winslow. He was born in 1877, and after being educated at the Massachusetts Institute of Technology, he taught at the University of Chicago, the City College of New York, Columbia, and Yale, and served as editor of the Journal of Bacteriology and the American Journal of Public Health, and was president of the American Public Health Association. At Yale, Winslow was chairman of the university's Department of Public Health at its inception in 1915. In the course of his 30-year tenure, he brought Yale, the department, and himself considerable international and national distinction and acclaim. Obviously, a lot has changed in the last century, and a lot has changed in the area of public health. During that time, hygiene developed into preventive medicine, bacteriology evolved to include parasitology and virology. Classical epidemiology evolved to include clinical epidemiology. Control of communicable diseases became chronic disease control, and public health increasingly focused on the social determinants of illness and health. Winslow developed public health into a premier educational program that graduated not only students with master's and doctoral degrees in public health, but also medical students imbued with, quote-unquote, a preventive spirit. Yale was the first academic institution in the U.S. to recognize the importance of public health by establishing a degree-granting program in the field. In 1946, the program was one of the first small groups of schools to be nationally accredited as a school of public health. 100 years after the inception of our school, and with the communities across the planet facing both old and new formidable health challenges, it is fitting to award the CEA Winslow Medal to Dr. Rodin, recognized by Forbes magazine as one of the world's 100 most powerful women in 3 consecutive years. As everyone here knows, Dr. Rodin is the president of the Rockefeller Foundation, one of the world's leading philanthropic organizations. Her journey to this post is marked by her lifelong dedication to the health and well-being of populations around the globe. Dr. Rodin was trained as a research psychologist and one of the pioneers of behavioral medicine and health psychology. In fact, the first time I met Dr. Rodin, I was a graduate student, and Dr. Rodin, very early in her career, but clearly one of the rising stars in the world, was invited in as one of the noteworthy speakers of psychologists around the country. After completing her PhD at Columbia University, she joined the faculty of NYU and was an assistant professor of psychology. She then moved to Yale in 1972, launching a 22-year career here. At Yale, Dr. Rodin earned an international reputation as both a pioneer of the women's health movement and one of the early psychologists to study both the biological and psychological factors that led to obesity. From 1983 to 1993, she chaired an international research network studying health-promoting and health-damaging behavior for the MacArthur Foundation. Prior to appointment as Yale's provost in 1992, she served 2 years as chair of the Department of Psychology and 1 year as the dean of the Graduate School of Arts and Sciences. A pioneer and innovator throughout her career, Dr. Rodin was the first woman named to lead an Ivy League university when she was named president of the University of Pennsylvania in 1994, and the first woman to serve as the Rockefeller Foundation's president. Dr. Rodin has received 19 honorary doctorate degrees and is the author of more than 250 academic articles and has written or co-written 15 books, including her two most recent, The Power of Impact Investing and The Resilience Dividend, Being Strong in a World Where Things Go Wrong. And if you have not read those books, I recommend them extremely highly to you. You will benefit from reading them and be better for it. A widely recognized international leader in academia, science, and development issues, Dr. Rodin has actively participated in influential global forums, including the World Economic Forum, Council on Foreign Relations, Clinton Global Institute, and the United Nations General Assembly. Dr. Rodin is also a member of the African Development Bank's high-level panel and a board member of the Alliance for a Green Revolution in Africa, which was co-founded by the Rockefeller Foundation. Since joining the Rockefeller Foundation a decade ago, Dr. Rodin has transformed the foundation's focus for the 21st century, launching major initiatives around the world to bolster resilience to climate change in poor communities, strengthen global healthcare systems, catalyze the field of impact investing, mobilize an agricultural revolution in Africa, and shape smarter, more sustainable transportation policies in the United States. The Foundation's system-based approach is enabling innovative solutions to the world's most pressing problems, plus a secure food, water, housing, and infrastructure, global health, environment and climate change, urbanization, and social and economic security. In sum, there are few people in the world who have had such a profound impact on global public health and resilience. In the spirit of Winslow, this work has involved innovative, interdisciplinary solutions that directly promote Winslow's goal of preventing disease and promoting health. It is thus an extraordinary honor and privilege for me to present the Centennial CEA Winslow Medal to our esteemed guests. Please welcome Dr. Judith Rodin to share a vision for the future of Public Health 2.0, aligning people and the planet.
Thank you so much.
I think we're going to have to get the obligatory picture.
Right. Thank you. Thank you so much. You just take that off the podium. I would appreciate it. Thank you. Well, this is wonderful. Thank you so much, Dean Cleary. And I understand that you'll be stepping down in the spring, so let me take a moment to congratulate you on your success in leading this vital institution into its second century. I can't tell you how delighted I am to be back in New Haven, so thank you for giving me the opportunity to come home. Looking out across this audience of scholars and students, women and men from literally all over the world, I marvel remembering my early days here when Yale was hardly as diverse. In fact, when I first came for my lunch interview, and I think Alan Wagner will remember this, for my faculty position, I had to go in the side door at Morey's, which was the only way that women could enter that then all-male club. It now seems so long ago, and yet we still have so much further to go to ensure that the incredible gains we've made in public health and in so many other areas are felt equally by women and girls around the world. But that's a topic for another lecture. I spent more than 2 decades here, as you heard, the bulk of my academic career in these halls and labs and offices from Kirtland Hall to York and Whitney Street. Yale is where I grew as a scholar and as an investigator, where I gained inspiration from brilliant students as a teacher, and where I had the privilege of challenging and mentoring some of the world's most foremost thinkers, really, and doers, including my postdoc and your colleague and recipient of the Connecticut Public Health Association's Winslow Award, Jeanette Ikovics, and my dissertation advisee, your president, Peter Salovey. Yale gave me the opportunity and the space to do work that pushed the boundaries of the disciplines of public health and psychology and medicine at a time when this was extremely uncommon and very, very difficult to do elsewhere. It is also where I learned my first lessons in the science and the art, mostly the art, of leading large institutions. For instance, how, as provost, to balance interests to keep more than a dozen diverse and strong-willed entities, the college, the graduate school, the extraordinary professional schools, including the School of Public Health, working together and pulling in the same direction. I will always feel incredibly lucky and grateful for my years at Yale, so thank you for honoring me and for inviting me to be part of the School of Public Health Centennial celebrations. It is humbling to be included in this remarkable list of public health heroes that the dean mentioned, including my co-recipients, Tony Fauci and Michael Marmot. And so many of the public health, as I think about it, gains made in the last century, the creation of Connecticut's Department of Public Health, the idea of prevention as a cornerstone of public health, the idea of how to improve air quality in schools, building low-income housing, strengthening nursing education, can be traced, at least in part, to Winslow's leadership, his energy, and his vision. So I am truly honored to receive the medal that bears his name. Today, as we celebrate the great achievements made by the School of Public Health in the last 100 years, I'd like to spend our time together to highlight the urgent and complex health challenges waiting for us in the next 100, and how we can meet them by supporting the creation of a new discipline, a discipline that we are currently calling planetary health. The Rockefeller commitment to public health began in 1909, a few years before the foundation was officially chartered, with a $1 million investment by John D. Rockefeller Sr. to launch the first ever public health campaign in American history. At the time, 4 out of every 10 people in the American South were infected with hookworm. The majority of its victims were poor. They lived in dilapidated housing with primitive or no plumbing. The disease sapped victims' energy, leaving them unable to learn or to work, trapping them, their families, and their communities in poverty. While hookworm was devastating and pervasive, scientific advances had made the disease treatable. And Rockefeller's great insight, which led in part to the creation of the field of public health, was that it was preventable through improvements in sanitation, such as the construction of latrines and widespread education about the disease. However, the South's capacity to bring this knowledge to bear was extremely limited at the time. Just 3 southern states supported a health department. The Rockefeller Sanitary Commission for the Eradication of Hookworm Disease recognized that if efforts were to be successful, battling the disease would have to be interdisciplinary, community-wide, involving both treatment and prevention, one that depended not just on the hard work of doctors and nurses, but also on the mobilization of government officials, churches, schools, the press, and other actors all working together. They enlisted communities in a 3-pronged approach. First, mapping the disease. Second, diagnosing and treating patients. And third, and perhaps most important, educating the public about sanitation and prevention. The approach worked, and eventually families were able to live free of this health threat. Most importantly, the campaign led to the establishment of public health bureaus and systems in states and counties that didn't have them. The success of the hookworm campaign convinced Rockefeller and his advisors of the power of a public health approach to reach and improve the health of entire communities, not just individuals with access to medical care. They recognized that by investing in public health as its own field, they could create an entirely new discipline, one that would foster new ways of thinking, forge new solutions, and train a new cadre of health professionals. I am proud to note that Professor Winslow and Yale were important early pioneers and partners of the Foundation's public health work. In 1918, when the Foundation sought to explore ways to increase the corps of public health nurses, we found a strong ally in Professor Winslow and appointed him chair of our committee for the study of public health nursing education. This led to the creation of the Rockefeller-supported Yale School of Nursing in 1923, the first university-based school of nursing in America. We supported Yale's early efforts to bring together the teaching of public health and preventive medicine. And in 1964, we transferred the Rockefeller Foundation Virus Laboratory to the Yale School of Public Health, bringing leading Rockefeller-funded scientists to Yale, including Dr. Max Thaler, a Nobel Prize winner for his work on yellow fever. Certainly, there's no question that due to the agricultural, industrial, and public health innovations of the 20th century, we in the 21st century are living healthier, more prosperous, and more productive lives than ever. Life expectancy has doubled, as you can see in this slide. Infant and maternal mortality are declining throughout the world, and 8 out of every 10 people are living in countries now where poverty is decreasing. In fact, just last month, the World Bank announced that by the end of this year, for the first time in history, fewer than 1 in 10 of the world's people will be living in extreme poverty, and that is a remarkable advance. The tremendous economic progress that has accompanied these health advances are notable. However, they have required very substantial alteration of our natural systems. About a third of the ice-free and desert-free land surface has been converted to cropland or pasture, and every year, roughly half of all accessible fresh water is appropriated for human use. Since 2000, human beings have cut down more than 2.3 million square kilometers of primary forest, with the new areas of deforestation shown on the red in this map. We've dammed more than 60% of the world's rivers. The environmental cost of all this activity and progress has been quite substantial, from shrinking rainforests to declining biodiversity, from severe water shortages to the acidification of oceans, from unchecked air pollution to rising temperatures around the world. For example, an example well known, I'm sure, to many in this audience, the concentration of major greenhouse gases, carbon dioxide, methane, nitrous oxide, have reached their highest levels for at least the past 800,000 years, with the most dramatic increase, as you can see in the figure on the right, in the last 60 years. In addition, today, species are going extinct at a rate more than 100 times that observed in fossil records. And vertebrate species have had their population sizes cut in half in only the past 45 years. While the degradation of biodiversity and the environment has been recognized, and certainly many of you are working in this area, its extreme impact on human health may not be as widely recognized. I can say it simply: we have been mortgaging the health of future generations to realize economic and development gains in the present. By unsustainably exploiting nature's resources, it is very clear that up till now human civilization has flourished. But now, with substantial health effects on future generations from the degradation of nature's life support systems, all of nature's life support systems, not only those affected by climate change. These striking trends are exacerbated by highly inequitable, inefficient, and unsustainable patterns of resource consumption and technological development, together, of course, with population growth. For example, the same fossil fuels driving development have also led to high levels of air pollution, especially in our fastest growing cities. As many of you well know, particulate matter caused by the combustion of fossil fuels, specifically fine particulate matter with a diameter of 10 microns or less, can penetrate and lodge deep in the lungs, contributing to the development of cardiovascular diseases as well as lung cancer, respiratory diseases as well. The World Health Organization has found that 7 million men, women, and children die prematurely every year due to these air pollution-related diseases. Nearly 9 of 10 of these early deaths occur among people living in low and middle-income countries. As noted in the next slide, which is a breakdown of those deaths attributed to specific diseases linked to air pollution. On the left, outdoor air pollution, and on the right, indoor air pollution. Most of the deaths are attributable to cardiovascular disease and stroke. But, and here's a critical point that is not widely understood, if you add together all of the disease outcomes and focus only on outdoor air pollution, more people die from outdoor air pollution alone than from malaria and HIV/AIDS combined. But look at the distribution of our research funding. Scientists predict that if an action is taken, the number of deaths, if no action is taken, the number of deaths caused by outdoor air pollution will double by the year 2050. Next, every day, we're seeing the impact of environmental changes on health outcomes related to food security. Soil erosion and desertification have taken some 12 million hectares of agricultural land offline, and you can see that noted in the yellow and orange on this slide. So we are at an increasingly rapid rate clearing land, and in many cases destroying land for agricultural production. But we are doing it so inefficiently and ineffectively that the data show that it's resulting in a loss of up to 20 million tons of grain every year. In just one generation, 37 African countries have experienced reduced agricultural output due to a dramatic decline in soil fertility. In addition, declining numbers of animal pollinators, such as honeybees, threatens both agricultural productivity and nutrition. Over 25% of the world's most important crops depend on animal pollinators. Crop pollination by insects has been estimated to be worth $14.6 billion a year to the U.S. economy alone. Moreover, many plant-derived sources of vitamin A, iron, and folate depend on pollination. A decline in these crops leads to vitamin deficiencies, undernutrition, and even increased death rates. Reducing carbon dioxide levels, recognized as a key driver of climate change, are another effective intervention, but instead, as we see rising levels of carbon dioxide. If that continues, they are also expected to reduce the amount of key nutrients in staple grains, such as wheat and rice. So the indirect effects on human health are demonstrated here. Without a reversal of these levels, the impact on poor communities who are especially dependent on these grains for nutrition could truly be catastrophic. In addition, our fisheries around the world are in dramatic decline. Nearly 90% of global marine fisheries are overexploited or fully exploited, according to FAO's global assessment. Marine fisheries supply the main animal protein for more than 1 billion people, and nearly 3 billion people get 20% or more of their animal protein from fish. Today, in a stunning statistic that really is not well known, Europe's seas are estimated to hold less than 5% of the total mass of fish that once swam in those waters. We often think that is Japan that is overfishing, but European fishermen are now fishing deeply off the coast of Africa because of the decline in fish in their own waters. Further, global environmental degradation has changed patterns of the emergence and spread of disease. For example, recent estimates suggest that an additional 200 million people are at risk of malaria due to climate change. Rising temperatures, this is a rise of 0.85 degrees Celsius since 1880, with a projected rise, as we know, between 2.6 and 4.8 degrees by the end of the 21st century, are causing diseases that were once limited to the tropics, shown in yellow, and they're moving further to Europe and North America, which you can see shown in red. The risk of new patterns of malaria transmission is also increasing, of course, as deforestation creates new breeding sites in which malaria-carrying mosquitoes thrive. Importantly, they don't exist in such abundance in an intact rainforest. It is human disturbances that creates their optimal habitat. Further, a quarter of all natural habitats have been converted to other land uses, leading to increasing human contact with wildlife, an increased risk of transmission of potentially deadly animal-borne diseases, such as Ebola, which we saw so tragically in West Africa. Environmentally linked declines in biodiversity have also eliminated predators who kept disease-carrying vectors in check. These are just a few of literally hundreds of examples of the connection between the health of our planet and our own health. Just 2 years ago, the Rockefeller Foundation celebrated our own centennial, and to help mark that milestone, we held a series of probing, forward-looking conferences around the world. During our meeting in Beijing, we challenged the participants to dream the future of public health for the next 100 years. The health and environmental challenges I just described so briefly were very much on the minds of everyone there as we looked out on and breathed in the smog in that city. We reached consensus that we needed a new frame for public health in the 21st century, one that builds on the innovations of the 20th century, but also recognizes the inextricable link between human health and the natural systems, the full array of natural systems on which life depends. One that ensures that the activity of human systems, be they political, economic, or social, align with the requirements of natural systems to ensure that we have safe, sustainable environments which are essential to human health and prosperity. In other words, we need an approach that embraces not just public health, but planetary health, a public health 2.0, if you will. How might public health 2.0 differ from its previous version? We all know that more than 150 years ago, John Snow, perhaps truly the father of modern epidemiology, was able to trace the source of a deadly cholera epidemic to a single contaminated water pump in London. You can see from the map on the slide how the epidemiological approach identified so clearly the source of contamination. However, in the 21st century, the root cause of planetary health challenges are not always as specific as a single contaminated water pump. The solution not always as easy as the simple removal of its handle. Let's take the example of schistosomiasis, the snail-borne parasitic disease affecting millions in tropical and subtropical nations, and you can see especially so in Africa. Studies have shown that schistosomiasis infections rise in communities that are nearby dams being built. The standing water created by dam reservoirs enable infected snails to thrive and to reproduce in greater numbers. We know that the public health methodology of mapping and education and treatment has made tremendous differences in combating the disease. But a planetary health approach, where public health professionals would be consistently working at the beginning of the process with engineers, with government planners, with environmental scientists, to make well-informed, dynamic decisions about where and how development occurs, might prevent outbreaks from occurring in the first place and yield more lasting results. That is the potential of planetary health. I congratulate you on your new program on climate change and health, and I had a chance to chat with some of its faculty leaders this morning, and it embraces many of the planetary health principles already. I hope, as we discuss this morning, that we can work together on this issue in the years to come, progressing beyond climate change to think about the impacts of all of our natural systems on health. Launching a new field, as we know from experience, requires a lot of changes. Huge changes in public policy, the creation of government agencies, transformations in research and training, and the really changing of public expectations and behavior, making people think and behave in new ways. It also requires the melding of disciplines in new ways, bringing together diverse minds and opportunities to problem solving. Public health practitioners and environmental scientists, as you are doing, but also veterinarians, forestry experts, economists, engineers, technologists, systems thinkers, and urban planners. Following our January 2013 Beijing meeting, the Foundation convened, in partnership with the British medical journal The Lancet, a multidisciplinary group to develop a set of principles to guide this proposed new field of planetary health. Based on their recommendations, we're funding some preliminary activities. We're supporting research efforts, such as the Wildlife Conservation Society's HEAL initiative, which is a consortium of 20 partners working together to explore rigorously the linkages between human health and natural systems. We're also funding the creation of a Planetary Health Alliance and steering committee to develop curricula to train the world's first planetary health scientists, convene and work with scholars around the world, and conduct advocacy work to ensure an enabling policy environment for planetary health. To help test our new concept, we're also piloting planetary health solutions for diverse and pressing challenges ranging from fighting Ebola to fighting forest fires. Let me give you an example so you can see how far-reaching this can be taken. There's no question, if you look at the data on the growth of intensity and impact of forest fires, this is in the western United States, that these have been hugely on the rise and that they are caused in part by human activity. We also know that such fires pose a great threat to human health, both directly through toxins released into the air and indirectly through the loss of biodiversity essential to buffering disease. But the burden of fighting so many forest fires with limited resources has kept the U.S. Forest Service from focusing on fire prevention, even though the data show that it is 40 times more costly to try to fight and suppress wildfires after the fact than it is to prevent them. So we have funded the development of forest resilience impact bonds to be sold in the open market for the first time this year, which will raise badly needed funds from private investors to finance forest restoration treatments to reduce the intensity and frequency of wildfires, and also through these interventions to increase water availability and water purity for local communities. Investors are paid back by local water and electric companies through their resulting cost savings from the intervention. The Forest Service wins. They benefit from cost-effective preventive measures, while investors win because they reap both financial and environmental returns for catalyzing a social good. So what this planetary health approach allows you to do, among other things, is figure out how to align incentives among all of the actors so that you can have transformational impact. In launching this new field of planetary health, I think we will face three big challenges. The first is one of imagination. For the last 85 years, the world has relied on gross domestic product as the chief indicator of human progress. But we have failed to account for future health and environmental harms over present-day gains, with the disproportionate effects of those harms on the poor and those in developing nations. We must imagine and establish a new indicator, one that measures human progress as what measures our progress as progress in balancing economic development with human health and protecting the environment as two critical components in that metric. The second challenge is a research and information challenge. There are still so many significant gaps in our understanding of the social and environmental drivers of human health, as well as, of course, the impacts of natural systems and climate. We've got to increase our support for inter- and transdisciplinary research necessary to bridge these gaps. And here I know I'm preaching to the choir. But present research limitations should not delay action. Which brings me to the final challenge, a governance challenge. We've got to find ways to help and encourage governments and institutions to respond much more quickly and much more nimbly to environmental and health threats as they're detected, and to embed directly into the DNA of government policymaking a proactive recognition of and a respect for the links between economic development, natural systems, and human health. The appreciation of nature's capital and nature's subsidy should be accounted for so that economy and nature are not falsely separated. If we continue to falsely separate them, we will continue to threaten the health of the future. Policies should balance social progress, environmental sustainability, and the economy. And those working on it need to systematically think about all three simultaneously. To support a world population of 9 billion or more, which is the prediction, resilient food and agricultural systems are needed to address both undernutrition and overnutrition, to reduce waste, diversify diets, and minimize environmental damage. Planetary health, we believe, offers an unprecedented opportunity for advocacy of global and national reforms, new types of taxes and subsidies for many sectors of the economy, including energy, agriculture, water, fisheries, and health. And regional economic trade treaties, such as those we are working very hard to sign now, should act to further incorporate the protection of natural systems and health in the near and long term, and not be separated out as they have been in the past. I invite all of you to join in this mission, to seize unparalleled opportunities to seek new knowledge, to harness new technologies, and to create new forms of governance to advance planetary health. It is clear that the challenges before us are serious, in some cases I would say even dire, but we can't afford to just shrug and hope for the best. As a psychologist, I'm committed to the belief that individual and collective involvement in the world is worthwhile. We can never underestimate the human capacity to damage, but also our capacity to remedy, to mitigate, and to build anew. If anything, That is what the last 100 years or more of our respective institutions and this great field of public health have taught us. And it's what will inspire us to launch a new approach to health for the next century, enabling, as CEA Winslow had hoped, and I quote, for every citizen to realize his or her birthright of health and longevity. Thank you. Thank you.
Wow. Thank you for that daunting but inspiring vision of the future and the challenge that faces us. And now I'd like to welcome Dr. Judith Ikovics, one of our esteemed faculty members, for some brief comments, and then there'll be a question and answer period. Judith?
Judy, it's a profound honor to be here with you today to celebrate your CEA Winslow Medal in this, our centennial year. As you know, I've just returned from London, and I did go actually I went to Soho to see the pump, but I was also reminded, I couldn't resist, but I was also reminded of the formative work of Sir Geoffrey Rose in the Strategy of Preventive Medicine, published nearly a quarter of a century ago. And as many of my colleagues and students know, Sir Geoffrey Rose famously set forth the theorem that a large number of people exposed to a small risk may generate many more cases of disease than a small number of people exposed to a large risk. Your career is marked in part by a corollary to this theorem, specifically that a large number of people exposed to an intervention with even modest effects may generate the most productive health gains. And it seems to me that this is part of your vision. And so I bring this forward today, reflecting on your career at Yale and at Penn, and now as president of the Rockefeller Foundation, which indeed is focused on the importance of evidence-based and evidence-informed interventions to catalyze change. Your early work in aging and obesity and in women's health, and your work now on planetary health has stretched the boundaries of traditional thinking, as we have all heard today. And as such, you have and will continue to have impact on millions of lives, both domestically and globally. You are a visionary, and you've been able to bring this vision to reality because you inspire others, because you conduct and support the most rigorous science, and because you imbue a sense of passion, compassion, and dedication to your work and to those of us who have been privileged to be around you. So I had the opportunity to work with Judy beginning in 1989. And I felt like you took a big risk hiring me as a new postdoc with limited experience. But I had an insatiable appetite to observe and to learn from you and the incredible transdisciplinary team that you assembled at Kirtland Hall and also as part of the MacArthur Network on Health and Behavior. You fostered in me and in others the grit and determination to bring evidence to action to improve the health and well-being of individuals and of communities, and particularly of those underserved and vulnerable. Judy, you gave me the opportunity to come to this great institution of Yale, to learn, and in turn to teach and mentor the next generation of scholars in psychology and forestry, in medicine, and in public health. In your talk today, you reminded us of the deep foundation of a century of public health upon which we build, from the eradication of hookworm to unprecedented social and economic progress. Nonetheless, you articulated the grave threats of climate change and environmental degradation and persistent poverty. You stated the connection between the health of our planet and our own is abundantly clear. And you set forth 3 challenges. to us all to foster imagination, to generate knowledge, and to develop and implement governance structures to improve public and planetary health. These are tremendous challenges, though ones as part of the academic lineage of CEA Winslow, to which we should feel determined to rise. How can we align incentives for transformational impact, as you posed? And with that, I get to congratulate you once again as the recipient of the CEA Winslow Medal. I thank you for seeding my career and so many others. And I turn it open to you for questions and comments. And as you get your thoughts together, I will take the chair's prerogative of the very first question and ask, how do we best foster imagination within academia and between academia and the many other stakeholders?
I really do think we talk so much about systems thinking, and I think it starts there, but I'm really talking about systems action. We need deep disciplinary research. That is the fundamental building block for all of this. But if we don't design and understand the total system, and each of us is working on one small piece, we miss the huge opportunity to imagine where the tipping points are. So we talk all the time at Rockefeller about leverage, and whenever we go into an area or try to create a new area, we actually map the whole system. And we do that because we want to seed those things that look like they have the opportunity to produce tipping points, and that's one part of imagination. We want to diagnose immediately where what we call the antibodies in the system are going to be, those elements that are going to push against the interventions that we're trying, and often we don't do that enough in our work. We have a amazing vision and great hypotheses, and we're testing and challenging, but we don't ask ourselves what other forces in that system may be pushing against our very good ideas and our very good interventions. So that part of imagination is critical. And then I think we cannot confront the challenges of the 21st century, certainly these challenges, without finding unlikely partners. New ways of influencing and interacting with governments, deep and important new ways of engaging the private sector. There's so much of what we do and what we fund at Rockefeller, and I mentioned this just in the forest resilience bond examples, but you can really be transformational if you figure out how to align incentives. But often, so much of what we're trying to accomplish conflicts with incentives that another element of that system has. And we don't think about it enough. We don't imagine how we could realign things to align incentives. And I talked about a couple of interesting examples with some of your colleagues this morning. And so as we do that, you really can have transformational impact. I'll give you one quick example and then throw it open to others for questions. I shared with them an experience that S.A.B. Miller had, the bottling, well, not only bottling, beer-producing company. And the largest bottling plant in Bolivia was their plant. And they found, in Colombia, forgive me. They found that their water costs were increasing dramatically, and they were ready to pull out of Bogota and other parts of the country. And we brought them together with the Nature Conservancy because obviously there's some reason why the cost of water is going up. And so the Nature Conservancy examined what was going on upstream, and they found that dairy farmers, because of climate change, were clearing more and more lands for their herds to graze, and that was degrading the riverbanks, and the soil was falling into the river, and so the cost of cleaning the water was escalating dramatically. Instead of leaving, they looked at what their costs of water were then and what they had been, And they collaborated and they bought new kinds of herds for the upstream farmers, herds that were more productive and required less grazing land. So, and then the Nature Conservancy taught the farmers how to also be riverbed stewards. They didn't know what they were doing, and they didn't understand the impact of their behavior. So the cost of water went back down. The dairy herds became more productive, therefore increasing the livelihoods of the dairy farmers, and the environment was better secured and better restored. That's what I mean by saying you can look at every point in the system and intervene if you think about it differently. Those interventions are possible. This is the kind of thing that ultimately I think is necessary when we talk about imagination really needing to change.
Questions, comments? Raphael, there are Heidi's coming with. Or Denise.
Good afternoon. My name is Rafael Perez Escamilla. I'm a professor with chronic disease epidemiology and social and behavioral sciences. And thank you very, very much for a most inspiring presentation. I was a member of the 2015 Dietary Guidelines Advisory Committee. And for the first time, we included the topic of sustainability with a strong message that food choices matter for the health of the planet. And the hope was that the federal government would end up incorporating that aspect of our report into the Dietary Guidelines for Americans policy document. However, as you can imagine, the beef industry got extremely upset with our decision to include that aspect in our report, lobbied very strongly with Congress, and Congress called for hearings, specifically the House Agricultural Committee, where they dragged the Secretaries of Health and Agriculture, essentially forbidding them from including the topic of sustainability as part of the Dietary Guidelines for Americans. So my question is, what can we do to navigate better these waters and end up policymakers and food industry to behave in a different way to protect the health of the planet?
So I didn't say this was easy. I just said it's necessary. I do think we are seeing glimmers where we can push against a more open door. And my advice would be to start there. Again, we work on reports with a specific focus, and if that specific focus doesn't get adopted, it's easy to immediately imagine that nothing will or can because there's opposition. So the Department of Agriculture just announced a huge commitment to reducing waste and spoilage in the food chain by the year 2050. We helped, with the mayor of Milan, launch a initiative that hundreds of cities around the world have signed on to and gave a declaration to the Secretary General in October to reduce waste and spoilage in their cities. So if we conquered the waste and spoilage continuum from post-harvest loss all the way to what winds up in the garbage can, in the developed and developing world, we could feed 9 billion people nutritiously in the future. It is the single largest intervention that is necessary, but it takes imagination across every element of the value chain. So new technologies for smallholder farmers, hermetic bags, on-farm processing, so that they get less post-harvest loss, developing new kinds of secondary markets so that things get to market more easily, takes a different kind of intervention. And then, as we are doing, in addition to that, negotiating with multinational sourcers, big companies, to buy the aggregation of what these smallholders are doing. So that's the sort of developing world post-harvest to table. And then the developed world, as we all know, is paying much more attention now to sustainability. Large companies in how they're sourcing, companies that use a lot of fish, sustainable fishing. So you start to see where those elements are changeable. I think that's one. I think a second is how many large companies have committed to zero impact on water. So a lot of the large bottlers now, a lot of the large chemical companies, really understanding the unbelievable effect that loss of fresh water is having and the degradation of the water supply on the future of the planet, have really committed themselves. 20 years ago, they would have lobbied against this. There's absolutely no question. So start working, if you really are serious about this, not just in the thing that you're most passionate about, but the thing that you think can show the most demonstration of how it works, because that's ultimately what will move in other industries and government policies and the like. I was asked and did work with Fortune magazine this year to help them create a list of the 20 companies in the world who have shown most effectively that they can make a profit and do well for the environment and having social impact. It's in the September Fortune, and it's worth taking a look at, because you want to, you can name and shame, or you can celebrate those activities where it is going on as another way to keep pushing the kind of progress that we need and that you can talk about.
Dr. Amy Justice.
Thank you, Rodin. Thank you for a great talk. Most of us are measurement people, and I know you are as well. It strikes me that the measurements that we use to have driven public health to where we are now probably need to be rethought. And I'm curious what you think the metrics of the future should be to drive planetary health.
So we've been funding an initiative that started with Michael Porter called the Social Progress Index, which is really trying to replace the economic price index. And many, many countries voluntarily in the testing phase allowed themselves to be pilot countries. And it measures both individual health and well-being, economic variables and social variables, but also natural systems in the health of the planet. That's one. There's one that I'm less familiar with, but it's getting a lot of attention, called the Happy Planet Index. So that's another where, so clearly you're right that what we measure, what we can measure, we pay attention to, and we transform that which we measure. It starts to be really critical in helping to effect the systems change that we're really looking for. And I do think that as all of these kinds of experiments with alternative metrics arise, we need your colleagues. Don't leave out the economists in all this stuff that you're doing. They really, really are critical partners to produce this kind of change, because it really is, among everything, economic progress that has really helped to produce this vast decline and this rapid decline that we're seeing. And again, I want to reemphasize so much that this is way more than climate change. This is a total loss of biodiversity on which everything in the environment and then everything in human health depend. And so we've got to get back down to the root causes and many of these variables as we start to approach this problem.
Before we break for lunch, we'll take one more before we go across the street for lunch. And the economist, Dr. Jody Sindelar, had her hand up earlier, and you seemed to cue her up perfectly.
Great.
So my name is Jody Sindelar. I'm a professor here in the School of Public Health and Health Policy and Management. And you somewhat answered my question, but I appreciate that you expanded the view of what is public health to planetary health. But I was wondering if one of the key segments or points of your analysis should be emphasizing social issues more, not just social, as we all know, and I know you know well, social determinants of health, but also social outcomes. And maybe you answered that a little bit when you talked about different ways of measuring well-being. So just, that's my basic question.
Right, so absolutely. The way this is being formulated, social variables are both independent variables and dependent variables in this process. So we know, and of course Michael Marmot spoke to this group about the social determinants of health, but social outcomes are determined by these natural systems and by what we are doing in terms of natural systems. So who is hurt more? For example, we at Rockefeller do an enormous amount of work on resilience, as I think you know. And if you look at who's most affected by the shocks and stresses that are coming with increasing frequency, whether they're tsunamis and typhoons or hurricanes, or it's always the poor and most vulnerable, both because of where they live and because of their capacity to, their more limited capacity to rebound more effectively. So what's great about taking a systems approach here is that you're not limited to a view of just antecedents and outcomes as one or another of these types of variables. It really is quite circular, and you need to think about it that way, which is a new methodology, I think, in terms of our statistical tools. As well as a new framework for how you're really developing your hypotheses and what you're testing. So I have the great privilege of being able to really have worked in fundamental research, have worked in applied research, and now as a funder, and one that really is able to look in a very systemic way to try to tip systems as we talk about it, to step back and take a wider lens to really thinking about some of these issues. And I have found it so profoundly important and so incredibly useful in breaking down kind of narratives, in finding new allies, and in generating new ways of thinking. So I've been very privileged, and I'm happy to share a bit of that with you today. Thank you.